Hello, hello. So week three. This is my editing page. It looks a little bit different uh, for your viewing pleasure. Um, this. So I've given you several links here, just to flesh out things. Um, but none of this will be on the quiz. Again, it's just my effort to make the whole experience more interesting and arguably more educational, but I won't be testing on that. Um, this is quite the chapter. Um, it's well written. It's historical. It's accurate. It's a topic I would normally not have spent a lot of time on. It's a pretty huge chapter. I think we're all happy that you get to do this open book because there's an incredible amount of content in here. But the quiz should not be too crushing. So, the objectives that the book gives you are I vote excellent. Um, I would look at these to let you know what you're about to experience in chapter three. And when you're preparing for the quiz, I would look at them again and take a shot at answering these questions. Of course, open book. Um, and there's, wine with cocaine in it. And that brings me back. Oops, this should have been number one, but it's okay. So there's Vin Mariani, French tonic wine. Yeah, the cocaine would do that. And there's a reference to Coke, Coca-Cola, and there's the Pope Leo the 13th giving it a papal award because he liked it so much. And as I think we've already alluded to, Freud was a fan of cocaine for a while too. Um, so just a little bit of history, nothing testable. Um, and right, land of the free. Uh, we cared about some recreational drugs because we wanted to tax them. And the Whiskey Rebellion was quite the event. Um, and it happened out west. Of course, back then out west was Western Pennsylvania. And it was a big deal. Uh, George Washington had to call out the militia. And I've given you a link to that as well. Um, this was formative, and militias were used to put down this rebellion. It's so funny to see, Western grievances. Uh, it's hard to imagine Western Pennsylvania being the West, but back in the day, it was. So that's an important historical thing. It also, gives us perspective on what the government cared about, not the consumption of alcohol, but the taxation of alcohol. Um, and this issue of two important classes of drug laws, one regulating drug companies, physicians, etc., to dispensing things, safety type issues, And then there's also taxation and regulation from that perspective. There is a distinction between symbolic results of legislation and instrumental effects of criminalization. And I've alluded to before, and the book in this chapter does a lot, that these laws have had a major impact on the criminal justice system and who ends up in prison because of it. The Harrison Act is important. I didn't give you a link, but I think we've done Harrison before. Um, it was a little loose with its definition, um, and we were moving from being real laissez-faire free market to we need some regulation of things, and we were moving towards prohibition of alcohol, which is, I've said before, a very big thing for organized crime. Um, and race relationships, not only with blacks, but Chinese and Mexicans. Some of our drug laws clearly have racist roots. Um, and I feel like before I mentioned Sears catalog used to sell you morphine in the needle if you wanted it. Um, those are the days, my friends. Um, and physicians used to be fairly liberal with the letting their patients have access to opiates. By the way, somewhere in this chapter, they do call what everybody else calls opioids opiates. It makes me happy. Fentanyl is in the news a ton. Um, it's very potent. You don't need a lot of it to get a therapeutic effect. And a lot from China was coming in, and it was cheap and incredibly potent. And if the chuckleheads who put together your illegal dose misplaced decimal point, could lead to very rapid death. And again, I think I've mentioned, two dead parents in the front seats of a car with a kid in a car seat in the back. This has been a real problem. It can be used extremely safely in a medical environment, but when people don't understand the drug, 50 to 100 times as potent, uh, that's potentially dangerous. And there's naloxone, a personal favorite of mine. I've done tons and tons of research with naloxone. It blocks the effects of opiates beautifully, and it's a very safe drug. And we're trying to make it that more people have access to it because it can definitely save lives from heroin, morphine, fentanyl, whatever. Naloxone works really, really well. Patent medicines became popular. Um, they were not as uh, regulated as they should have been. There's a discussion of Hofstadter's bitters. They got in trouble because they didn't have enough alcohol. Um, and there's a big history of opium and opium use in China. China regulated this and didn't want their people to be using it. The Opium Wars, Great Britain and the United States and some famous Americans even were involved in, you wouldn't think it, but importing opium to China against Chinese laws, and people made a pound of money doing that. I provided you with a link here. Astor and FDR's father were involved in selling opium to the Chinese. They made a pound of money, and Great Britain did too. Um, we didn't do good things. And when we brought Chinese workers here, the Transcontinental Railroad was important, and they brought in smoking opium, and parts of the country with high Chinese populations started regulating things, and of course, uh, uh, they were not. They didn't look like regular Americans, so the government was more than willing to oppress their drug of choice. Cocaine, we've already mentioned a few times. Um, and there was a lot of fear mongering regarding cocaine and what it led people, particularly people who we were afraid of, from doing. And amphetamine and cocaine really do increase behaviors that should not be uh, encouraged. So some of this was true, and some of it wasn't. And there's the Pure Food and Drugs Act. The jungle was important for this, and I provided you with a link to that. Um, the purpose of the book was not to encourage pure food and drug, uh, but it did talk about the beef industry, and it was horrific. Uh, some would say it's still horrific, but it was filthy and horrific back in the day. And after this book, in part because of this book, people demanded better regulation of foods. Uh, Heinz, as in ketchup, also encouraged this. They were making their food to a very high standard, and they encouraged the federal government to get involved in making everybody make foods to their standard. Um, the they knew they were ahead of the other food manufacturers, and so that they were already in compliance with soon to be created regulations. So it promoted their uh, their product to encourage clean foods. Now, this is an eBay link, so I'm not sure it's going to survive, but this is one of the patent medicines. I mean, look what it fixes: tuberculosis, bronchitis, colds, infantile paralysis, uh, and you just put it on your skin and off you go. People were claiming crazy things, and we really do need to be protected from people like this. Um, some supplements that people buy today are less regulated than I would like. Um, I remember these Carter's Little Liver Pills. This was in my lifetime that these were being sold. They're they're they were a patent. Oh, Erie, Pennsylvania. Um, they contained little bits of liver in candy coating, and pretty crazy. So it was a checkered history, and we needed to be protected. You can't expect average humans to do the research necessary to protect you from, false claims. We had a president once who didn't want to regulate a subset of the banking industry, and saying that people could just, study their savings and loan and decide whether their savings and loan was solvent. That was crazy. And then, there's Harrison and Taft and China, and they had to register, pay a little tax. Um, it was a tax law, but it there's the Opium Exclusion Act, uh, emotional and outright racist attack. Yeah, that's the history of our drug laws. Immoral Chinese opium dens, and this hysteria over its effect on, quote, our women. Um, and this is an important subset here. Two bureaus, two types of regulation. Uh, Agriculture, that things were honestly labeled, whereas the Treasury Department was largely involved in taxing and eventually alcohol prohibition. My drug license comes from the Treasury Department, and I don't even like to think about it because they can audit me at any time. Pure Food and Drug Act, again, 1906. Uh, they tried. Um, Big companies tried to do the right thing. Littler companies did less. The FDA, over time, has done more and more to protect people from things, and the FDA is in the news now, and in terms of approval of vaccines uh, for our current um, uh, corona vaccine problem. Quack medicines. I worry about this a lot. And there are some people who like homeopathy, which is basically selling you water. How that's still a thing, I don't have a clue. And people who work outside of traditional medicine and promote natural cures and homeopathic cures, some of them are doing real damage, and they really should be uh, better regulated. And sulfa drugs were used as antibiotics, and boy, we needed them. You saw a video earlier of antibiotics overcoming antibiotics. Um, and here's a tragic story with 107 people dying because of a formulation uh, that caused real damage. And now in 1938, uh, we want proof that a drug is safe before it's released, which seems so obvious. It's uh, it's hard to believe that it took so long for us to get to this position. Um, Speaking of drug labels, there was a president, the same one who thought uh, people should be able to figure out whether their savings and loan was solvent. There used to be very extensive literature inside prescription medications about safety and interactions and side effects, and he got rid of that too. Um, Now we're into the 50s, and there's I'm Alive Now, and there's Carter's little liver pills. Unbelievable. And thalidomide. Whoa. That was a deal. I've given you a link here. Now, thalidomide has legitimate medical uses to this very day, but early on, boy, we dodged a bullet here. Drugs taken by pregnant women can have very negative effects. So there's a discussion here about what the thalidomide can do. That's useful, and it is still used today. And if used appropriately, it's very safe. But early on, these pictures of thalidomide babies, uh, prenatal exposure to drugs can have dramatic effects on the development of the body. And I won't enlarge the pictures, but boy, that was real, very real. We need some regulations. We need protection. Um, the downside of regulation is it slows things down. Um, but being dead is bad, and having flipper limbs for the rest of your life is bad too. You have to voicemail. Um, in my lifetime, they were giving injections of steroids into joints, which I almost got, and it had the formulary that was making it had fungus in there, and people got horrible effects from that. Some of them unto death. You really have to know these phases, and you've been exposed to these phases in discussions of the COVID medications. Phase one, phase two, phase three. These are very important. And phase three, they're big, and drug companies are not supposed to legally, hide data that are bad. They have to register. Everybody has to know what's going on, and the data have to be made public. And you're watching this play out in the COVID Orphan Drug Act. That was a big deal. That's also all this is my time now. Some people, like I have a condition that is not popular, and therefore people aren't spending a lot of time trying to fix it. So the government, I think, ethically has developed ways to help drug companies develop drugs for people who have conditions that are not popular enough so drug companies can make a pound of money on them. Um, War on drugs comes up again. Um, FDA updates. Why does it take so long? It takes a long time, and you get a 20-year patent on a drug, but usually you only get to sell that drug in a relatively small percentage of that 20-year patent window. So, don't cry for me, Argentina. Drug companies make a lot of money, but developing a drug takes a long time and costs a lot of money. We have to be sensitive to both ends because we want effective drugs. By the way, antibiotics right now, we're probably not making enough of them, in part because if they work, you don't need them anymore and you don't make a pound of money. Now, this concerns me a lot. Dietary supplements. These are not as regulated uh, as they should be. And if you get these, you'll see the label, not intended to diagnose, treat, or cure or prevent any disease. The consumer really doesn't worry about that. They see the ads, they take the pills, and sometimes bad things happen. Ephedra, that was a deal. and bad things happened, and we eventually got it under control. But people were hurt. Now, this rings a bell. St. John's Wort. Um, I had a student long ago who had depression, and they didn't want to go to a physician. And St. John's Wort, there were data indicating that it could be effective against some forms of depression, and it was used in Europe. And GNC is right there. GNC was selling back then St. John's Wort at a concentration. They basically just took the flowers and stomped on them and stuck them in capsules. The research that indicated that worked used much higher concentrations of the effective substance, and basically you were just paying for plastic capsules of stomped on flowers. Kava kava is ginkgo. Geez, I've had students and or me have experiences with all of those, and they really, the government really should protect us. Um, and Harrison Act, this Dr. Webb was going crazy. Um, in the early days, we beat up on physicians and pharmacists. um, Possibly not the best way to go. We increase penalties, and there are laws, and some of them you could get the death penalty. This is probably a bit much. Uh, Prison is not a very effective way to treat drug problems. And we've gone through phases of trying to deal with drug offenders um, in more humane ways. These narcotic farms, Kentucky, I think that's where we have the federal marijuana farm, which grows one kind of marijuana, which is not as diverse as what's out there anymore. J. Edgar Hoover, not a huge fan of J. Edgar. Um, and There's the end of Prohibition, and there were cutbacks, and we had federal infrastructure and criminal justice infrastructure for suppressing alcohol, and we moved over largely beating up on marijuana, and certainly and marijuana being referred to as a narcotic. It so is not if you understand what the term narcotic means. Um, and then there was we're in the McCarthy era now, um, that, 1955, uh, communist China was trying to demoralize the US through drugs, and the McCarthy era. I lived through it. I wasn't really very aware of it. I've given you a link to Joe McCarthy, who was, by the way, who was an opiate addict. And he was from Wisconsin, and he definitely used the big lie. He kept claiming he had lists of communists in the federal government, and he never published the list and how many commies there were. He changed across time. Uh, I vote he was a force of darkness. Um, yeah, and it took a while for us to stand up to Joe. Some very brave persons, including a senator from Republican senator from Maine, finally stood up to this guy, and he fell out of favor. But boy, he did a lot of damage. and not just in the war on drugs. Commissions. Are you now, or have you ever been a member of the Communist Party? And people lost their jobs and couldn't make movies, and it was bad. Um, there's a big world out there, and I mentioned this before. There are other ways of dealing with drug problems. Uh, Portugal and Uruguay have taken an interesting path, and it's more humane, and it seems to be better than maybe what we're doing. Thailand may also um, follow that path. So many people in emergency rooms and in prisons because of drugs. So many. Um, and if you want to design, later we're going to deal with addiction and how to treat it and learning theory and addiction. And you put people in a weird environment like a prison and you dry them out and say you're cured and then put them back on the regular streets and they start acting out their addiction again. We can't be surprised by that. Uh, you go through extinction in a weird environment like a prison. That does not generalize um, well to the real world. And here's an effort, 1970, which is about when Nixon was deciding to keep marijuana legal. But yeah, they were trying. Uh, they tried to have a fresh start and uh, uh, do the right thing. And the Drug Enforcement Administration was formed there, more liberal, mandatory penalties uh, were gone away. Uh, but that didn't last. Um, Schedules of drugs. You should know this table. Uh, and Schedule 1 has particular relevance to me. Criteria: high potential for abuse, no currently acceptable medical use, lack of accepted safety for use uh, even under medical supervision. Uh, Marijuana, MDMA. Heroin, by the way, is used in Europe to treat pain because sometimes when you're dying of cancer, there's not much of you left, and heroin can be concentrated better than morphine, and it just turns into morphine when it gets to your before it gets to your receptors. Of course, fentanyl can be concentrated too. There's Schedule 2, high potential for use, currently acceptable medical use, uh, and so on through the schedules. Uh, and yeah, there's stuff that is relevant in there. That was a big deal. I think except for Schedule 1, we have pretty rational schedules. Um, so we tried to fix this problem, the differential criminalization of cocaine and crack. We really beat up on crack use, and we tried to resolve some of this. I mean, look at that: 500 grams of cocaine, 5 grams of crack, 5-year prison terms. I don't think it helped. Um, and Look at what the feds could do. Uh, they could, seize I don't know where this is, but they could seize property. Uh, they could seize your family's property. Uh, they really went over the over the edge. Um, sentencing laws. Yeah, there we go. Before the Anti-Drug Abuse Acts, there were few penalties and little interest in convicting users for small amounts. You could be fined up to $10,000. You could lose the car you were in if they suspected you. Um, and student loans, grants. Uh, it was pretty bad. Assets, homes, farms. Uh, Now, designer drugs are cute, and bath salts, which I did a, a local uh, news thing on. Um, if chemists can come up with a formulation that's not on the federal lists, it, it's legal. It's also real dangerous, and the feds are always trying to play catch up. There's bath salts right there. Uh, that's a bad one. Bath salts uh, can trigger really inappropriate, aggressive behavior. When I was first asked about talking about it, I didn't know anything. I had to go look it up. And once I looked it up, I said, oh man, these are bad drugs. And so I did a talk. Um, yeah, we are the United States, and states have rights, and states can have their own laws, and they can affect many things. And right now, what's big is marijuana laws, because some states are saying it's chill to use marijuana, but the federal law still has marijuana as a Schedule One. And look at that. Look at Americans in prison. We have the highest proportion of our citizens in prison of any civilized country. Uh, Lives ruined, money spent. I don't want crime. I don't want drug-induced death. But there's got to be a better way of dealing with these things. And there's state versus federal. Uh, Obama did one thing. I'm sure Trump did something else. Um, there's discussions of whether marijuana will be legalized again under the current administration, and we have a person running for the Senate in Pennsylvania who thinks that marijuana should be legalized. I'm pretty sure I'm a fan. Boy, the drug screening. Reagan really went after drugs and urine tests, and you don't want people messed up on drugs, flying planes and running trains. Um, Private employers, little less so. You can be positive, for example, with some tests for marijuana for a long time afterwards. Drug tests for welfare recipients. Jeez. I don't know. We we really beat up on some people. And drug testing students. I mean, uh, these are controversial issues. Uh, we have to be smart. And you can see 2003 random testing of all students, testing methods, urine tests, hair tests, um, and false positives start showing up in here, where you test positive and you shouldn't. I used to love poppy seed bagels. Poppies, even the ones on your bagels, trace amounts of, I would say, opiates, but it says opioids, And there have been instances where people were flagged for opiate use because they ate poppy seeds. Um, and you can do it at home, and parents can test their kids. And uh, you know, DEA, FBI, IRS, tobacco and firearms. The military is now involved. Again, Reagan using the U.S. military to regulate incoming drugs. This is something that was quite atypical for most of our history of our country, but now we do it, and we spend a pound of money doing it, and we're involved in international programs to restrict this. And sometimes when other countries don't do what we want, we do what we can to beat them up. And we'll see how Uruguay goes. 20% of the budget, Homeland Security, drugs, so much money, so much time, so many arrests, international drug trafficking, and you still see pictures of interdictions with tons of marijuana. And there's our friend, the opium poppy. And there are countries where growing this is part of their culture, and we're not a fan of that. Afghanistan is famous. Do they work? They certainly work. Do they work? They don't work very well. Sometimes prices go up, but sometimes even prices don't go up. But people go to jail, and we spend a lot of money, and I don't know. It can be quite depressing. So there's the summary. I think the beginning list is quite good. There's early 1900s, 1906, IND. You have to indicate that you've got a drug and test it before you give it to people. There's the Harrison Act, and there's the use to suppress physicians from giving it to addicted people. And there's marijuana, amphetamine, everything. There's 1970 direct federal regulation of drugs, not through taxation. Then there's the schedules, which are very big on money laundering. Oh boy. This is a very important chapter. I apologize that I don't have a lot to offer. Things are still not clear in terms of what to do about this. But I think I'm a fan of the war on drugs being a failure. I forgot I gave you a list, links to MDMA, ecstasy, which I know early in my teaching career was pretty popular with you guys. I don't think I would take it. I've seen some images of rat brains being affected by it, so not on my list. GHB. GHB is very interesting. Again, like some other things, this is actually used medically in Europe, and it's very related to a very important neurotransmitter in our bodies. Um, and it it can be used as a date rape drug. It can also be used in Europe to make birthing babies better. Um, so it's complicated. There's the date rape. Uh, it can certainly do bad things. Ooh, look, endogenous production by your own body. And you know how it works. Again, I'm not testing on this. I just want to enrich your lives. Okay, so that's it for this week. Uh, I look at this chapter and thank goodness you have an open book test because, oh my God, there's so much data in this chapter. Um, I hope you enjoy it and talk to you soon. Bye.